Hello, my name is Dr. John Weston. I'm a general dentist at Scripps Center for Dental Care in La Jolla, California. I'm here to talk to you about oral cancer today. Basically, what is oral cancer? It's basically any kind of cells that are rapidly growing in the mouth and that appear abnormal under a microscope. They can form a lump and they can also spread to other parts of your body. In general, people that are at risk for oral cancer are smokers, people who drink a lot of alcohol or have a history of using alcohol, and patients who are over 40 years old. Tobacco is also a strong contributor to oral cancer, and it causes many types of cancer. It doesn't just cause lung cancer, but also can cause bladder cancer. There is a saying that the bladder remembers every cigarette you ever smoked. Cervical cancer is also found in smokers, along with esophageal cancer, kidney cancer, laryngeal cancer, and some types of leukemia. So what do you need to know to prevent oral cancer? Basically, don't smoke. And that includes cigarettes, cigars, pipes, hookahs, cigarillos, and any type of clove cigarettes. We also recommend you don't chew tobacco. So what else can you do to prevent oral cancer? Well, one basic thing is get regular dental checkups. See your dentist at least once a year, and your hygienist or the person who cleans your teeth at least every 6 months. Dentists and hygienists both look for oral cancer and do cancer screenings. And a lot of people are not sure how we do that, but it's very basic. We just look at the throat and the mouth and the lips. We also check your head and neck area in general. We do one exam of the neck. It's called a lymph node palpation. A lot of people think lymph nodes are only up front. We actually palpate in the back of the neck also. The other thing you should know is if you ever feel changes in your mouth and they don't heal right away, you should always see your dentist. If your dentist says don't worry about it, but it continues on, it's a good idea to see another dentist. If the dentist sees a lesion in your mouth or an area of concern, there are a lot of ways we can determine what that area is. One way is to do a biopsy. Biopsies are done in a number of different ways. Mainly what we try to do is remove a little bit of tissue, take a look at it under a microscope, see if there's a sign of cancer. Now we're going to be showing you some photographs that may not be appealing, but it's important for you to see what cancer looks like. We want you to have all the information available and have a good visual picture of what cancer can do. We do a number of different biopsies, and I'm going to show you some examples. The first example is a brush biopsy. It's a small brush we use to sweep the tissue, and it will pull cells, and we can look at those cells under a microscope. We also do incisional biopsies, which is where we take a small piece of tissue using a blade, and all this is done under anesthetic. And then we also do a punch biopsy, which is where we take a little cookie cutter piece of tissue with a round punch. We'll show you an example. And the last one is a surgical biopsy, where we may remove the entire area. The first type is a brush biopsy. Brush biopsies are not painful. We take a small brush and brush the area maybe 10 to 15 times, and some bleeding can be normal for that. That brush will then collect the cells, and the cells can be placed on a slide. I'm going to show you some pictures of that right now. Now the biopsy is then mailed to the laboratory, and the laboratory will then look at those specimens under the microscope and determine if there's any areas of concern. The best news is that it's negative and all cells look normal. There are also two other possibilities. We could have atypical cells, which are not totally cancer, but they're not normal, and it's an area we should watch and maybe look out for future changes and possibly do another biopsy. And lastly, there could be a positive result. Now, positive results can be precancerous or could be true cancer. It definitely will become cancer someday if it's not fully developed at that point. The second type of